The views, opinions, and findings contained in this podcast are those of the host and subject matter experts. They should not be construed as official Department of Defense positions, policies, or decisions unless designated by other official documentation. Hi, welcome to Clinical Updates in Brain Injury Science Today, or CUBIST, a podcast for healthcare providers about current research on traumatic brain injury, also known as TBI. This program is produced by the Traumatic Brain Injury Center of Excellence, or TBI COE. I'm your host today, Don Marion. I'll be speaking with Amanda Gano. Ms. Gano is a physician assistant and TBI subject matter expert at TBI COE. Amanda and I will discuss a study entitled Efficacy of an Interdisciplinary Intensive Outpatient Program in Treating Combat-Related Traumatic Brain Injury and Psychological Health Conditions. The article was written by Thomas DeGraba and his colleagues at the National Intrepid Center of Excellence here in Washington and is published in the journal Frontiers in Neurology in January of 2021. Hi, Amanda, and thanks for bringing this article to our attention. Could you tell us a little bit about the study?
Hi, Don. Sure. So, I'm excited to talk to you about this article today. This study was completed, like you said, by our colleagues at the National Intrepid Center of Excellence, or the NICO. So for those who are not familiar, the NICO is the Center for Treatment of Traumatic Brain Injury and Psychological Health Conditions, and it's located at the Walter Reed National Military Medical Center in Bethesda, Maryland. So this study took a close look at the efficacy of their Interdisciplinary Intensive Outpatient Program, or IOP. The IOP is a 4-week program that uses traditional rehabilitation, neurological, and behavioral health treatments combined with other integrative medicine interventions and skills-based trainings to treat TBI symptoms and psychological health conditions. The IOP, they use a 17-discipline team to expedite diagnostic evaluation and allows each specialty team member to build on each other's expertise and achieve the common goal of developing a collaborative care plan for the patient. So, Don, it's really just like a nice, fancy way of saying that all of the patient's care providers are in the same place and they're able to communicate with each other and work together to achieve the common goal of treating the patient. So the other really interesting thing about this program is that the patients actually stay on site in housing accommodations that are provided for patients and family members at Walter Reed. And similar accommodations can be found at many different MTFs. So the patients are able to attend their appointments easily. It's really convenient. They are reporting to the NICO every single day while enrolled in the program. So it's a really nice patient-centric approach to care.
It sounds like a really unique program, Amanda. Can you tell the listeners a little bit more about how the intensive outpatient program differs from conventional treatment of post-concussion syndrome?
Sure, of course. So this program has 3 foundational principles. The first is to immediately provide a safe and trusting environment and address sleep disturbances and pain, which are key. The second uses a patient-centric approach to facilitate self-identification of the physical and existential injuries that result in major post-concussive symptomatology. The third is to provide training and education to optimize a patient's long-term self-efficacy and self-advocacy. So, Don, when the patients first arrive at the NICO, the very first day, they meet with their care team all together in the same room for this intake interview. The care team consists of an internist, a neurologist, a psychiatrist, a neuropsychologist, a family therapist, and a designated nurse specialist who serves as the service member's main touch point throughout the program. After that, the patients engage in about 6 to 8 hours a day of clinical care during their program. So the program includes an intensive evaluation and treatment of headaches, neurological, vestibular, musculoskeletal, optometric, and audiologic disturbances. They also use a rehab approach that includes cognitive rehabilitation strategies with a speech-language pathologist and physical and vestibular therapy. And additionally, the program uses other really unique integrative management modalities like creative arts therapy with music and yoga, and mind-body techniques, acupuncture. They do nutrition classes, and they even use animal-assisted therapies.
It certainly sounds very comprehensive, Amanda. It is my understanding that conventional treatment programs follow a lot of the same principles, but this program is unique in that treatment is compressed into several hours a day for 4 weeks. Is that correct?
Yes, that's correct, Don.
So tell me, Amanda, how did they actually conduct this study?
So the group assessed the efficacy of the IOP by conducting pre- and post-program evaluations in multiple different disciplines. The patients with completed assessments at both admission and discharge were included in the primary analysis. So for long-term follow-up, the patients were required to have completed assessments at both admission and discharge, and then have responded to at least one of the 1, 3, or 6-month follow-up encounters to be included in the analysis. The study used 7 different validated symptom scores, and those were the Neurobehavioral Symptom Inventory, or NSI, the Post-Traumatic Stress Disorder Checklist Military, or PCLM, the Satisfaction with Life Scale, the Generalized Anxiety Disorder 7 scale, or GAD-7, the PHQ-8, or Patient Health Questionnaire 8, the Epworth Sleepiness Scale, and the Headache Impact Test 6, or the HIT-6. The group did a comparative analysis of these symptom scores before the program, and then at 1, 3, and 6 months follow-up over the course of 7 years.
So what did they find?
So they had 1,456 patients that consented to the study. The study population was predominantly male, 98.4% male, and the mean age was 38.3 years. The majority of the members of the study were in the Navy with 51.5%, and then also in the Army with 30.6%. The participants had a mean service record of about 17.3 years, and the majority of patients in this study, so about 90%, had a history of multiple TBIs. After treatment in the 4-week IOP, patients whose symptom severity was at or above threshold at admission showed clinical improvements at discharge in all of the 7 assessments. In addition, an analysis of all the patients, regardless of their presenting symptom severity, showed improvements across all 7 assessments post-treatment. The average follow-up rate across assessments was 15% at 1 month, 11% at 3 months, and 10% at 6 months. So to address the concern that only those that had the best recovery would have returned the electronic follow-up report scales at 1, 3, and 6 months, the follow-up percent of patients who clinically improved during the 4-week IOP was then compared to the follow-up percent of patients who did not have clinical improvement, and no significant difference was found.
So these were service members who had been serving for quite a while, Amanda, 17 years on average. I think they did the right thing in comparing those with improvement versus those without improvement. But there was still a very high attrition rate in the sample, with only 10 to 15% completing the follow-up questionnaires. What are some of the other limitations of the study, Amanda?
Yeah, Don, you just touched on the first and the biggest limitation. Their follow-up rates were quite low at 1, 3, and 6 months. So it's still unclear what the long-term efficacy of this type of program really is. Additionally, they didn't use a control group, so future studies could consider using a waitlist control to better confirm the program's efficacy, or they could consider a comparison to another outpatient program. Another thing was that there wasn't really a cost analysis included in this study, so while this program is very, very comprehensive and appears to be effective, it would be really interesting to see if something like this would be sustainable long-term from a cost perspective, or, better than a less comprehensive or less expensive outpatient care program.
Good point. With all those specialists that they included and so forth, it would seem that it might be cost prohibitive, at least in the private sector. So, Amanda, what were the key takeaways that you want the provider to know about this study?
Don, I think that the IOP model that they have at the NICO is a really comprehensive program that incorporates many different specialties into the care of service members after mild traumatic brain injury. So this study indicates that improvement for some of the most troubling symptoms associated with concussion and psychological health conditions can occur with a patient-centered, multidisciplinary, and holistic team approach. So follow-up over several months to years will provide a better indication of sustainability and efficacy of these programs. So I think future research into programs that are structured similarly would be great and may provide, cost analysis or comparison data so that we can know for sure.
Thanks, Amanda. Unfortunately, that's all we have time for today. You can stay up to date on future episodes of CUBIST by subscribing on iTunes, SoundCloud, Stitcher, or wherever you listen to podcasts, where you can also find links to the articles we discuss and other relevant resources. CUBIST is produced and edited by Vinnie White and was hosted today by me, Don Marion. It is a product of the Traumatic Brain Injury Center of Excellence, a division of the Research and Development Directorate, J9, of the Defense Health Agency, and led by Division Chief Captain Scott Pine, Medical Corps, United States Navy. Thank you for listening to this episode.